Anxiety, also known as generalized anxiety disorder, is a neurological condition characterized by persistent, uncontrollable worrying or apprehension accompanied by emotional distress. Patients with diagnosed anxiety experience symptoms most days for a period of 6 months or longer. In addition to worrying, common signs and symptoms of anxiety include times restlessness, times irritability, times pain or discomfort in the chest or abdomen, times nausea, times fatigue, times difficulty sleeping, times breathing rapidly, hyperventilation, and increased heart rate. Risk factors for developing anxiety include genetic predisposition, family history, being female, recent life stresses, chronic physical illness, and concurrent mental health conditions such as depression. Normally, a region of the brain called the prefrontal cortex, PFC, inhibits another brain region called the amygdala. This inhibition of the amygdala keeps anxiety, fear, worry, and similar responses at healthy levels. Patients with anxiety exhibit a hypoactive PFC, meaning there is less PFC activity than normal. As a result of lessened PFC activity, the PFC doesn't inhibit the amygdala enough, which causes heightened anxiety. Neurotransmitters are chemicals that enable neurons, nerve cells in the brain, to communicate with other neurons. The binding of neurotransmitters to receptors on the surfaces of neurons results in excitatory, inhibitory, or modulatory responses. Here we see a healthy amount of neurotransmitters released into the synaptic cleft, where they bind to their receptor and prompt a healthy signal. An imbalance of specific neurotransmitters, like norepinephrine, serotonin, dopamine, and gamma-aminobutyric acid, GABA, can influence the activity of the brain and lead to symptoms of anxiety. As an example of lower levels of neurotransmitters, here we see serotonin molecules released into the synaptic cleft, where they bind with their corresponding serotonin receptors. With anxiety, there can be lower levels of neurotransmitters with less binding to the neurotransmitter receptor sites. This decreases the strength of the electrical signal that moves across the cleft and down the axon of the postsynaptic neuron.